Good afternoon. My name is Laura Crone, and I am the project manager for research and education at the Advocate Medical Group Adult Down Syndrome Center in Park Ridge, Illinois. Thank you for joining us today for our webinar on at-home treatments for common health conditions of people with Down syndrome. Our presenter is Dr. Brian Chicoine, who is the medical director of the Adult Down Syndrome Center. He is also on the faculty of the Family Medicine Residency at Advocate Lutheran General Hospital. He received his medical degree from Loyola University of Chicago, Stritch School of Medicine, and completed his Family Medicine Residency at Lutheran General Hospital. Next slide. In 1992, Dr. Chicoine co-founded the Adult Down Syndrome Center, which is a clinic for adolescents and adults with Down syndrome. More than 6,000 individuals with Down syndrome have received care at the center since its inception. Dr. Chicoine has provided medical care for adults with intellectual disabilities for over 30 years and has presented and written extensively on caring for adults with Down syndrome. Before I turn it over to Dr. Chicoine, I have a few reminders. Next slide. We are recording this webinar, and the link to the recording will be emailed to everyone who registered within 1 week. It will also be posted in our online resource library. Throughout the presentation, please submit questions using the Q&A button in your Zoom controls. Dr. Chicoine will address as many questions as he can at the end of the presentation. Next slide. And finally, this webinar is for educational purposes only. It is not intended to take the place of evaluation, diagnosis, or treatment by a qualified professional. All right, and with that, I will turn it over to Dr. Chicoine.
Thank you, Laura, and welcome everyone. What a pleasure to be here with you today. We're as Laura mentioned, I'm going to describe some common health conditions in adolescents and adults with Down syndrome, and focus on sharing at-home treatments for addressing these health conditions that you all can do at home. And I'm also going to discuss when to consult a healthcare provider about that healthcare condition, and in other words, when we should need to go beyond what you're doing at home. As I go throughout the presentation today, I will reference our resource library, and I encourage you to feel free to use that after the presentation. And we have lots of information on there. Certainly, we're not going to be able to cover all topics today, and so there's a lot more topics in our resource library, both materials that we have generated, but also links to good resources that other people have generated as well. So I encourage you to take a look at that. And as you can see from the slide there, that the resource library is divided into sort of three groups. Information that's directed towards people with Down syndrome to use themselves, information that's directed towards families and caregivers to use, and then information that is directed for healthcare professionals. Obviously, anyone's welcome to use all three of them, but we do kind of break them down into those categories. So I'm going to jump right in. The first topic we're going to talk about is earwax buildup or cerumen impaction. And so start with a story of saw a gentleman in his 40s that came to us, was brought to us because there was concern that he was developing Alzheimer's disease. He was not following directions, and there was concern that this was a sign of cognitive impairment. We evaluated him and found his ears to be full of wax, which is, you'll see in a moment, is a common thing in people with Down syndrome. And we were able to remove that wax for him, and then he was able to hear again, and he was able to follow directions. So it's always very satisfying when you can, if you will, cure Alzheimer's disease purely by washing some earwax out, which is something we do very frequently in this practice. So what are the signs and symptoms of earwax buildup? There may be a sensation of ear fullness. The person may develop hearing loss, just as the gentleman I mentioned did. Some people will get ringing in the ears or tinnitus. Some people will complain of ear pain. Some people will complain of dizziness. And some people will be noted they have an ear drainage or odor. For many people, there is very little, if any, complaint of discomfort or a finding other than finding it on a physical exam. This is more common in people with Down syndrome, and that's probably because of small curved ear canals, which are a common anatomic feature of many people with Down syndrome, and also dry skin, which tends to build up in the canal and cause increased earwax. And again, many people may not report symptoms, but also we may see things that are not traditional signs or symptoms of earwax buildup. So it may be that we notice a change in behavior. We may notice that the person is not paying attention as well. Maybe that the person is not following directions, as was the gentleman in the example at the beginning there. Or we may have a concern that the person is losing skills. It's also noted that people that, in addition to people with Down syndrome, who have more common problems with earwax buildup are people with hearing aids, people of older age, and also people that are putting cotton swabs into their ear canal. And again, certainly a number of our patients have hearing aids, and many of our patients, like their doctor, are getting older. And so those are all things that may be something that can contribute to this increased earwax buildup. Very important that you speak to your healthcare provider before using any at-home treatments for earwax. If you have a hole, if the person has a hole, a perforation, or a tube in the eardrum, typically or generally, it's not recommended to be putting any fluids or any drops or anything like that into the ear if there's a hole in the eardrum, either by a perforation or a tube. So again, it's generally recommended to not put any liquid in an ear with a tube or a hole. So what are some of the treatments you can use at home if appropriate for that individual? So over-the-counter ear drops with carbamide peroxide, such as Debrox, help dissolve the wax. We find that baby oil is particularly helpful, but there's also almond oil, mineral oil, olive oil, or diluted hydrogen peroxide, putting 3 to 4 drops in the ear, each ear, a couple times a week to help soften the wax and promote nature's general, typical ability to try to remove the wax. Again, if the wax gets very hard and sticky, it can get very stuck into the ear and be difficult for the body to remove naturally, as often happens. And again, you can use cotton swabs on the outside part of the ear, but again, we don't recommend cotton swabs on the inside of the ear. Another thing that you can do is some people that have eczema on the ear, where there's a lot of flaky, dry skin that's unfortunately getting accumulated into the ear canal. Sometimes using either one of the oils or using a 0.5% hydrocortisone cream on the outer ear, again, not in the canal, but on the outer ear to reduce that flaking that might be building up in the ear canal. Certainly consult your healthcare provider if there's a hole or a tube in the ear or a perforation, as I mentioned. And if the problem persists despite using those at-home treatments, if they're not successful, then again, that would be consulting a healthcare provider to have the wax removed in the office. Again, this is a very common problem. I do this all day long. I did it once already this morning at an appointment. So it's very common that this is something that occurs in people with Down syndrome. It has nothing to do with lack of hygiene or anything like that. It's really both an anatomic issue as well as in response to the increase of dry skin that we commonly see. Next topic we'll talk about is toenail fungus or onychomycosis. This again is unfortunately a common thing in people with Down syndrome. Many years ago, I was examining a young man's feet who had this toenail fungus, and he asked me what time it was. Thought that was kind of an interesting question for what we were in the middle of, and I looked at my watch and told him it was 10:17. He then proceeded to say, pronounce them, indicating that his toenails were not attractive, and he felt like they were quote unquote dead to him. So again, they were not causing him any problems other than they just did not look so nice. So he encouraged me to pronounce them, and I helped him with that concern. So what is toenail fungus? Well, signs and symptoms. It's It's typically a yellow to white discoloration of the nail, much more commonly on the toenail than on the fingernails, although it can occur on the fingernails as well. The nails tend to be thick and brittle. There may be splitting of the nails. There may be separation of the nail from the underlying skin, and there may be pain. Oftentimes, they're really, other than just the cosmetic appearance, for many people, there's no other symptoms. But again, it can occasionally cause some of these symptoms. Again, it's more common in people with Down syndrome. And this may have to do with the immune system. We know that the immune system's ability to fight infections in people with Down syndrome is also often has some impairment. And it may be also that, again, the dry skin that we talked about before with the ears may also contribute. In some individuals, self-care may be a problem where they're not, they haven't taken care of the hygiene of their feet as well as they might. Although one of my lines is that very few people with Down syndrome get away with poor hygiene, but unfortunately, many people with Down syndrome don't get away with excellent hygiene. So this problem can, even in those that are really doing very good skincare, this can still be a problem. Oftentimes, again, this is not reported by the individual as they're not having any real symptoms. But sometimes if they do have a symptom, again, they may not report that as well, but they may present as a change in behavior. If they're having discomfort or maybe their shoes don't feel right because the toenails have gotten very thick, those are reasons that the person may have a change in behavior. And so that's always something to look at as one of the things to look at if a person's having a change in behavior. I guess I did forget to finish the thoughts there on the more common venous insufficiency, which is where the where the veins don't return the blood back to the heart as well. So people will get sometimes some swelling, some discoloration of their lower extremities, and that can contribute to fungal infection of the toenails. Obesity can be a problem contributing. Hallux valgus or bunions are associated with increased toenail fungus, as well as poor fitting shoes. So a number of reasons why this can occur. And again, it is very common. I would guesstimate that close to 50% of our patients have this problem. So what are some of the at-home treatments? First thing is proper foot hygiene and washing and drying the feet daily, at least daily, and keeping the toenails nicely trimmed. There's some evidence that a diet that includes fatty acids like healthy fish and perhaps a fatty acid supplement, a fish oil or a supplement might be indicated. There's some data that suggests making sure you get enough calcium and vitamin D, iron, and protein are all in the diet to make sure to reduce the toenail fungus problem. Topical treatments, oftentimes these are improved if you wrap the toenail in gauze, and that may include Vicks Vapor Rub, just applying that once a day, tea tree oil or vinegar. I would say that some of our patients have had success with that, or some of the over-the-counter antifungal medications, ketoconazole, iconazole, or clotrimazole are all available over the counter without prescription that can be applied. And again, applying them and then wrapping the toenail with a gauze. And typically that's done at bedtime and then left on throughout the night. Again, as far as trimming the toenails, oftentimes many of our patients will find that trimming the toenails after the shower or bath, when the nails are a little softer, makes it a little easier. And then may help with the hygiene. Certainly, if there's a question of if you need to confirm the diagnosis or if it's not getting better, that would certainly be a reason to consult a healthcare provider. If the at-home treatments are unsuccessful, that'd be another thing to consider. A common reason many of our patients end up consulting a healthcare provider is that the nail care is not possible at home. And so, it's the nails become thick and difficult to cut. And so the individual may have to go to a podiatrist or whoever to have the toenails trimmed professionally. And then certainly if there's pain or there's any sign of infection, other infection, the toe is getting red or something like that. Those would be other reasons to consult a healthcare provider. Sometimes the only symptom of pain may be a change in the gait. The person may not walk the same. They may have a little more difficulty walking, or they may not want to run, or they may not want to participate in activities because they're having discomfort. And so those, again, that would be another reason to pursue additional care through a health professional. So again, it's a common thing that we see quite frequently in our practice. Regular hygiene is very important. For many people, it's more of a issue of cosmetics than it is anything else. And so then the question is, how aggressive do you want to be? Do you want to just stick with the at-home treatments, or do you want to really, if they're not working, do you want to pursue additional treatment with your healthcare provider? And those would be questions to answer for yourself, as well as to discuss with your healthcare provider. But again, certainly if there's any symptoms, or it's limiting the person's ability to participate in activities, or just even walk, or wear their shoes or whatever, then certainly those would be reasons to pursue additional care. So another pretty common problem in our patients is constipation. So I'll give you an example. We were asked to evaluate, again, I should tell you that all these little stories, these vignettes, are sort of a conglomeration of people. There's no one individual I'm referring to, and certainly not revealing any personal health information by sharing these stories. These are not really any one individual. These are many people all sort of blended together. But as far as constipation, we were asked to evaluate a middle-aged woman with Down syndrome who had become more irritable. Her communication skills were limited, so it was difficult to get more history from her. Upon questioning, it was noted that she was having less frequent bowel movements. The exam revealed a mildly distended abdomen, and at home treatment, at home treatment was recommended, and her symptoms resolved. Her constipation resolved, and her pleasant personality was seen once again. So certainly, constipation can be uncomfortable, and again is a common thing in people with Down syndrome. So what are the signs and symptoms? By definition, constipation is infrequent bowel movements, fewer than 3 a week. Although for many people, it's a change. So if the individual goes every day and now they're going every other day, or they're going, skipping days here and there, that's a change, and that may be enough to be a problem. Certainly, if the stools are hard, lumpy, and difficult to pass. If there's bloating, abdominal discomfort, certainly that can be a sign of constipation. If there's straining or bleeding and or pain when having a bowel movement, that's certainly something that can occur with constipation. Some people just feel an incomplete empty, and they feel like they've had a bowel movement, but they just have not really emptied, and so they're having a sense of discomfort from that. Conversely, some people will get incontinence and even diarrhea, particularly if there's a large amount of stool that's built up. Some people will get leaking of sort of watery or loose stools around the constipated ball, if you will, of stool, and so that can be conversely. So sometimes diarrhea is actually related to constipation. Some people will get urinary incontinence, where they're having urinary accidents related to constipation and the pressure that can put on the bladder. And some people will actually also develop urinary tract infections, and so it can affect beyond just the colon and just the GI tract. As far as considerations in people with Down syndrome, it certainly is more common. And again, just like the other things we've talked about, the individual may not report the symptoms, and so there may be something that's kind of building up, if you will, literally and figuratively, and they may not report those symptoms. And again, just like the other things we talked about, what you may notice is a change in behavior. So particularly if the person's uncomfortable, or they're disturbed by the change in their habits, their bowel habits, that may present as a behavior change. And the other consideration of people with Down syndrome is that I am convinced that many of our patients go through life at least mildly dehydrated, based on taking histories and doing a physical exam and blood work and urine testing, many of our patients go through life at least mildly dehydrated. There was a study several years back that, again, had nothing to do with Down syndrome, but was just done in the rest of the population, or in the general population, if you will. And the three biggies for causing constipation were had to do with dehydration, limited fiber, and lack of exercise. And the one that was the biggest concern in general was decrease in insufficient fluids. So drinking enough fluids is a very important part of addressing that. So certainly that's part of the at-home treatments, the drinking more fluids, as you can see in the second bullet there, but also certainly eating more fiber, such as fruits and vegetables and whole grains. Our fast food American diet can be have pretty limited fruits, vegetables, and whole grains, and certainly can contribute to constipation issues. Regular physical activity is encouraged as one of the approaches to maintain normal bowel movements or address constipation. Some individuals do better if they take a fiber supplement, such as Metamucil or Benefiber. Those can be helpful in some individuals. But again, we find that if the individual is not drinking enough fluid, that actually can become problematic. And so then you have this large amount of fiber in there that's not passing because there's not enough fluid. So if taking a fiber supplement, it's very important to make sure that the individual is drinking plenty of fluids as well. And then stool softeners sometimes are helpful, and those are available over the counter as a way to address constipation. Certainly, if at-home treatments are unsuccessful, if there is pain, certainly that would be a reason to consider a consulting healthcare provider. And if there's a big change, suddenly the person was having regular bowel movements, and now suddenly there's a big change, and there's no other reason that could be found, then we need to look to see if there's something else more concerning that is contributing to that. Certainly, if the individual is having increasing pain and then starts to vomit, and sometimes we'll get a fever, that can be a very concerning situation, and that person then needs to be taken to the emergency room to have that evaluated. So constipation for most people is just sort of a nuisance and can be addressed. But for some people, infrequently, it can become a much more serious health condition and a health concern, and needs pretty urgent or even emergent care. So again, this is something that's common in people with Down syndrome, and I like to say that the first three treatments for constipation are drink, drink, and drink. More fluids. A lot of the individuals that we see are not so hot on drinking just plain water. We have a number of, I'm talking about the resource library a minute ago. We have a number of resources in our library on fluids that some individuals with Down syndrome are more likely to drink, that are water-based, but have a little flavor without artificial sweeteners, and also carbonation can be a problem, particularly if one's already constipated. It just increases the gas. So looking to use fluids that are not carbonated, and ideally not with artificial sweeteners. But again, drink, drink, drink. How much should somebody drink? Certainly variation on that, but I think 64 ounces a day would sort of be what most people, at least that much for most people. One of the ways to check that would be just, in fact, I think we have if I recall, we have a handout on that in our resource library. Just looking at the individual's urine, if despite how much they're drinking, the urine is still dark, then they're not getting enough fluids, and so you really want the urine to be clear or pale yellow, and that would be one sign that the person is getting enough fluids. Next, let's talk about dry skin. Again, another common problem in people with Down syndrome. So a man in his 20s came to us because he recurrently had problems with infected abrasions. So he was having some scratches on his arms and legs, and these were getting recurrently infected. We prescribed appropriate management of the infections, either topical or oral antibiotics as the case was needed, but also recommended getting more aggressive with treating his dry skin. So most of these abrasions were self-induced, if you will, not as a mental health issue, but as just a response to dry, itchy skin. And so, again, in his case, with the use of home treatments, his dry skin improved, his scratching himself reduced, and his infections became much less frequent. And so, again, this can have some implications for more serious or concerning health conditions. So, again, dry skin, not a surprise, redness, flaking, itching, even cracking, and often worse in very cold or hot, but the key is the dry weather conditions. So, those of you in Arizona this summer with the 110 recurrently and very dry conditions, we don't typically think of dry in Illinois or Chicago in the summer. We don't think of hot and dry because we don't have hot and dry. We have hot and very humid. So this is less of a concern in the summer for us, but certainly in the winter, it gets very cold and very dry here. So this is a real problem in our practice in the wintertime particularly, but certainly for some, it's just all year long. So again, it's more common in people with Down syndrome. And again, as I mentioned, generally not a serious problem, usually just something that can be bothersome or even quite bothersome, depending on the individual, like the individual that we presented at the beginning. So what do we want to do? Certainly liberal use of moisturizing cream or ointment, better than lotions. Lotions tend not to be as moisturizing as the creams or ointments. And it may take 3 or 4 times a day. We do have a lot of individuals that probably have some degree of sensory weariness, if you will, of using the creams or ointments. And so really this is something sometimes we really have to work on to encourage. But 3 to 4 times a day may be needed to really take care of this. Sometimes if the skin is thicker and very dry, using a cream or ointment that has alpha hydroxy acids that help remove the loose layers of skin. And that may be helpful. One example is amlactin, which is available over the counter. And these are, again, ointments that contain this additional ingredient, if you will, to help remove some of the dry skin. As far as other ointments and creams, Vaseline, Lubriderm, Eucerin, Utterly Smooth, and many others can be used. Vaseline is relatively inexpensive and a great treatment for dry skin. So I'm a big proponent of Vaseline. Generally, we recommend applying it right after the shower or bath when the skin is moist. So in a sense, you're really helping trap the water in on the skin. And then again, particularly if there's a sensory concern, some individuals don't like the sensation of the creams and ointments. Putting on the feet or on the hands, you're putting on socks or gloves right after putting on the ointment or cream. And if you do that, right before bed, they can do that. Wear those for 5 or 10 minutes, and then take them off. Typically, if they don't want to wear them all night long. But again, that again is one way to help keep the cream and ointment on, but also sort of trap it in and help it be better absorbed into the skin. And again, on our online resource library, we have a video as well as some other handouts to help encourage people to use these products to help with their dry skin. The other thing, in addition to the topical ointments and creams, using a mild soap such as Lever 2000 or Dove or Dial with moisturizers or CeraVe, all those can be used as others to have less of a drying effect on the skin. For some, decreasing the frequency, length, and temperature of showers. Now, this can be a challenge for some people who also have challenges with recurrent boils or other skin infections. So trying to balance that. But even if you can't decrease the frequency, maybe the length and the temperature, so making it more of a lukewarm shower or bath and not having the person stay as long in the bath or shower can be helpful to both address both the recurrent infection issue as well as the dry skin issue. For some people, the changing the socks in midday is helpful, and that sweating can actually, in a sense, dry out the skin, and so changing the socks in midday might be helpful. And again, avoiding exposure to very cold or hot air that is dry. And so again, in the winter, we certainly around here, we recommend, using hats and covering faces when it's very, with scarves when it's very cold and dry. Gloves, very important to help keep the hands from getting dried out. So, and again, just like with decreasing frequency, length, and temperature showers for the hands, decreasing the length of time washing the hands. Now, again, I'm not suggesting not to wash your hands. It's very important. But again, using more lukewarm water can be one way to help with that. As well as topical creams and whatnot we talked about for hydration, just, adding a humidifier, making sure the air in the house is humidified can be very helpful with the dry skin. And then as well as hydrating from without, we want to hydrate from within. So again, going back to the good hydration issue we talked about before, is also very important with dry skin as it is with constipation. So drink is an important thing you'll see throughout the presentation today. And the other thing that's real important is the sun can have a very drying effect as well. So encouraging people to wear sunscreen, at least 15, if not 30, would be recommended. And a lot of sunscreens now come with a moisturizing cream, so you can kind of address two problems in one by doing that. Certainly consult your healthcare provider if an infection develops or the at-home treatments are unsuccessful. Sometimes something prescription may be necessary to address this. So again, this is a very common problem, people with Down syndrome, and some of the individuals we see find it challenging to use these ointments. And so I encourage you to take a look at some of the resources we have to try to encourage people to do so and to promote their use regularly. Another thing we see, probably not as commonly as the ones we've just addressed, but we do see, or not probably, we don't see as commonly as ones we just addressed, but this is something that we do see not infrequently, and that's chronic cough. So a woman in her 20s came to us because she had a cough for months and just wasn't getting better. She had used all sorts of different things at home and just wasn't getting better. And we did a thorough assessment and reviewed her home treatments and addressed all those. But despite that, the cough persisted. So we ended up referring her to an ENT. In her case, the home treatments were not successful. And we'll talk more about her in just a moment and what ended up happening. So what's a chronic cough? So a cough is defined as chronic if it lasts longer than 8 weeks or 4 weeks in a child. And there are many possible causes, and they can include allergies, asthma, viral or bacterial upper respiratory infections, lower respiratory tract infections like pneumonia, chronic bronchitis, habitual cough. Some people have almost like a habitual cough. It can be a medication side effect. Certainly if there's a foreign body in the nose or the airway, that can cause a person to have a persistent cough. And then there's a less common thing that's we've only seen a couple in 32 years, a spasm of the vocal cords. And that's actually what the woman I presented a moment ago had. And then lung cancer, but that's, again, solid tumors are uncommon in people with Down syndrome. And so cancers like lung cancer are quite uncommon. And frankly, we've only had a handful of patients that smoked as well. So the risk factors are less for people with Down syndrome typically as well. So lung cancer is not something we have seen. As I was looking at this, tuberculosis is another one I didn't add to the list, but that isn't one other thing to think about. But again, fortunately, we have not seen a case of tuberculosis in our practice in all these years. Really, in our practice, the most common three in people with Down syndrome would be postnasal drip, where whether it's allergies or whatever, there's a drainage down the back of the nose and throat, causing a persistent cough. Gastroesophageal reflux disease, heartburn, when the reflux goes all the way up into the throat, and sometimes even into the lungs, that can cause a persistent cough. And we're going to talk about that one more in a moment. And then a common one is post-infectious cough. So some people, when they've had a pneumonia or an upper respiratory infection or COVID or whatever the case may be, may have a cough that lasts literally for weeks, and even sometimes longer than the 8 weeks to qualify for chronic cough. So that's another common one that we see in our practice. And really that's lots of people have that after infection. So that's not an uncommon thing for anyone. So what are some considerations of people with Down syndrome? Again, I think it's more common, and that may be related to the craniofacial features. The anatomy of people with Down syndrome is such as smaller sinuses, the openings into the sinuses can be smaller. And so there's a number of anatomical reasons that people may get postnasal drip more persistently, or irritation that can contribute to this chronic cough. Adenoids or tonsillar hypertrophy is a common thing in people with Down syndrome, and that can contribute to cough. A small airway, and we do know that the airways of many people with Down syndrome is on the smaller side, and that can contribute to chronic cough. Low muscle tone in the airway. We know certainly that's an issue with sleep apnea, but also could contribute to a chronic cough. Obesity, again, tends to narrow the airway. And then, again, something we see causing postnasal drip commonly would be chronic vasomotor rhinitis. So it's not allergies, but there is a drainage that is occurring. It's interesting that allergies in general are thought to be less common in people with Down syndrome, but we do see a lot of what appears to be non-allergic postnasal drip, and that contributes to persistent or chronic cough in the number of people we have seen. So what are some of the treatments? Again, not surprisingly, oral hydration, good drinking plenty of fluids, very important. That helps keep the secretions thinner and allows the body to remove them more easily. Avoid possible irritants, and that may be changing the furnace air filter more frequently, keeping the windows closed at times when there is more dust blowing around. See some patients from more central Illinois, where there's a lot of farmland, and this can be a real problem particularly in the fall when their crops are being harvested and there's lots of dust, and so they really have to keep their windows closed even when the temperatures drop into more comfortable ranges, because the dust is blowing around and causing them so much trouble. And then sometimes more frequent dusting in the home is necessary to help with that. Might think about a cough suppressant such as a throat lozenge, tea and honey, guanfacin and dextromethorphan can be helpful. That's Robitussin DM. Honestly, if there's something in there that really needs to come out, we don't really necessarily want to be suppressing that cough, because that's the body's natural way of eliminating it. But if it's just sort of a chronic irritating cough, one of these may be helpful. And frankly, I find tea and honey works probably best or as good, or if not better than any of the cough syrups. So we recommend a lot of tea and honey for people that are trying to suppress the cough. And then nasal saline drops or rinses. So that may be the nasal steroids such as fluticasone or Flonase, or memetazone or Nasonex can be helpful to reduce the drainage and the inflammation and reduce the postnasal drip. And sometimes there would be just saline drops, saltwater drops that are available over the counter that you can drop in there into the nose and to help thin out the secretions. And then there's also some products that can be used to sort of rinse the nasal passages to reduce the mucus that's in there. Another thing that some people find helpful is to use the medication guafenicin or Mucinex. Again, its job is to it thins the secretions, and it again helps it easier for the body to pass those. But again, drinking plenty of fluids is also very important to help thin those secretions. So when would you consult a healthcare provider? So certainly if the at-home treatments are unsuccessful, just as we've been talking about, if someone was having weight loss without effort, that could certainly be a concern for something more concerning than just an irritation. That could be a more serious condition. Certainly if the person's coughing up blood or phlegm, if the person is having problems with wheezing or shortness of breath, If they have problems with hoarseness that doesn't go away, that could be a sign that there's something going on in their upper airway that needs to be addressed, or around their vocal cords. And then certainly a drenching overnight sweat can be one of the symptoms of tuberculosis, although I mentioned we have not seen it, but can be a sign of other concerning conditions as well. So again, not things that we've seen commonly, but something to think about. So again, with the chronic cough, I think we do see it more commonly, although it's not, I wouldn't say it's a common thing. And when we do see it, it's often very commonly related to either just a recent infection, and that ultimately will pass. And so treating it symptomatically for comfort in the meantime. And then the postnasal drip is a very common one. And so often that's related to irritants, and a number of the medications or approaches we talked about can help reduce that problem. So as I mentioned in the chronic cough, one of the causes for that is gastroesophageal reflux disease, or GERD. So we'll talk about a man in his early 30s. He wasn't functioning as well at work, and he was noted to be getting up more frequently during the night and having trouble falling back asleep. And so it was seen that he was not really having a cognitive impairment or some other issue other than his poor sleep was affecting his work ability. And so upon questioning, it was discovered he had changed his eating pattern about 6 months before. Previously, they had been eating dinner in the early evening, and then spending a few hours doing other activities before going to bed. And now they were eating later in the evening, just before bed. And so he would eat and go right to bed shortly thereafter. And so we discussed at-home treatments for GERD. His sleep improved, and over the next few months, his work performance recovered as well. And that would not be an uncommon occurrence in our practice. So what are some of the signs and symptoms of GERD, gastroesophageal reflux disease? Certainly the classic heartburn, pain in the chest or upper stomach. Again, as I mentioned with the cough, chronic cough can occur as if the reflux goes higher up from the stomach. The acid in the stomach contents go up out of the stomach into the esophagus and actually up into the throat, or actually even into the lungs. Some people will have a sense of regurgitation with food traveling back up into their mouth, which can be quite irritating. That may cause sore throat. Oftentimes people will wake up with a sore throat, and that lasts for an hour or so in the morning. And that may be a sign of reflux, that the acid is irritating the throat during the night. It can cause a sour taste, and particularly if it gets to the vocal cords, it can cause a hoarse voice. What are some particular considerations in people with Down syndrome? So the sphincter, the muscle between the stomach and the esophagus, the tube that runs from the mouth to the stomach, the sphincter at the bottom of the esophagus, whose job it is to relax as food comes down the esophagus, food and drink, and then once that food and drink enters the stomach, to tighten up again to prevent food, drink, and acid from exiting the stomach backwards up into the esophagus. So that's the sphincter's job. In people with Down syndrome, the tone, the tightness of that sphincter is often lower than it is in other people. So just naturally, by having Down syndrome, there may be more of a risk for gastroesophageal reflux disease. Unfortunately, other things that contribute to having GERD are being overweight or obese, and that is more common in people with Down syndrome. Sleep apnea, sleep apnea is in people in Down syndrome, most typically is the obstruction of the airway while sleeping. And so as people are trying to breathe deeply during sleep apnea to overcome this obstruction, it creates a negative pressure in the chest, and that sort of pulls or drags up stomach contents up out of the stomach, up into the chest, into the esophagus, not free flowing in the chest, but up into the esophagus. And that can cause more gastroesophageal reflux. Certainly dietary habits such as overeating, dietary choices, carbonated beverages, and eating before bed, as the gentleman in the example, all contribute to gastroesophageal reflux disease. When eating just before going to bed, we unfortunately do not take advantage of gravity. So after we eat and we're upright, gravity just helps pull things down. I mean, there's certainly a lot of body processes that are functioning for us as well to move things through the esophagus into the stomach and through the stomach and out into the intestines. But being upright just gives gravity opportunity to participate in that process. And lying down, actually, you lose that the advantage of gravity, and then so there's more likely to be reflux. The other thing we see in some people with Down syndrome is that they don't report the milder chronic symptoms. So they're having some heartburn or they're having some sensation of sore throat in the morning or some symptoms, but they just don't report it. And so the problem with that is that what we have found in a number of individuals, this chronic inflammation in the esophagus ultimately causes a scar and actually the narrowing of the esophagus, that tube between the mouth and stomach. And so with that narrowing, that ends up, then it's more difficult for food and liquids to pass into the stomach. And so I don't, this isn't definitive, but my sense of having seen a number that's occur a number of times over the years, I'm pretty convinced that this not reporting mild or chronic symptoms ends up being a problem for some individuals. And then again, sometimes the only symptom, as a gentleman in our example, the only symptom is poor sleep. People are being awoken by the reflux, and it's interrupting their sleep, and then can also then cause behavioral changes or functional changes, as occurred in the gentleman in the example. What are some of the treatments? So eating smaller meals. Again, if we overdistend the stomach, it's more likely, food is more likely to go backwards up into the esophagus. Eat more slowly, allow food to naturally pass through in a more controlled fashion. Filling the stomach very rapidly can be a problem. Certainly if the person's overweight, losing weight, and because the obesity, again, increases the pressure in the abdomen and can have a tendency to push stomach contents backwards up into the esophagus. And again, very important for the gentleman that we presented at the beginning here, do not eat 3 to 4 hours before lying down or going to sleep, if at all possible. Again, take advantage of gravity and let gravity do its job. For some individuals, elevating the head of the bed with a riser or blocks. You don't want to just put more pillows, because more pillows actually cause the person to sort of bend in half, and sort of bending in half increases the pressure in the abdomen, and then the food is actually pushed backwards more. So you want to really elevate the head of the bed with risers or blocks, particularly like on the legs of on the front of the legs of the bed. Mom was telling me just recently that they found, and I was not aware of this, but they found a mattress that is sort of a riser mattress that's actually thinner at the foot end, and thicker at the head end. So it's just a natural incline. And he has reflux, and he's been served very well by having that that mattress that's a natural riser. Certainly, obviously, you have to put the thick end on the head, of course, not the thick end on the feet. But that's been very helpful for them. And then sometimes over-the-counter medications such as Tums or Rolaids or Maalox can be helpful. And then there's a number of over-the-counter medications, H2 blockers such as ranitidine or Zantac, famotidine or Pepcid can be helpful in reducing the acid. And then some of the PPIs are available over the counter as well, Meprazole or Prevacid or Prilosec are examples. And again, those reduce the acid. They don't do anything to help with the sphincter, and they don't eliminate the issues of full stomach or addressing gravity or not overeating or any of those other things. So even if using medication, we still encourage using the other at-home treatments to help reduce this problem. And the graphic up at the top there is some information we have on our online resource library about what we call healthy pace for eating. We have both some visual handouts like that, as well as a video that encourage people to eat at a healthy pace, not too fast, in other words, which can cause more problems. And so again, that is unfortunately a common issue in the people we see with Down syndrome. And so we encourage them to eat more slowly and chew well, chew the food well before swallowing. Other things to avoid are fatty, spicy, and citrus foods, which can cause more acidic problems. Caffeinated or carbonated beverages. Caffeine reduces the tone of that sphincter and allows food to pass backwards more readily. And then carbonated beverages just fill up the stomach with gas and can, as a distended stomach, is more likely to reflux than one that is more empty. And then there are some medications that can make GERD worse. Again, usually in this case by increasing acid such as ibuprofen or Advil, naproxen or naproxen. Those are non-steroidal anti-inflammatory medications. Also aspirin. All those can have a tendency to make this worse. And then again, the whole issue of tight abdomen or increased pressure in the abdomen. Wearing clothing that is tight around the abdomen can contribute to this as well. So when to think about seeing a healthcare provider? Certainly, if the at-home treatments are unsuccessful, if the person is losing weight, if it's becoming enough of a problem that the person's losing weight without trying. Certainly, if one of the treatments is losing weight, so if they're trying to lose weight, that's one thing. But if they're losing weight without trying, that can be a concern of something more serious. Certainly, if there's recurrent vomiting, again, we talked about some people that end up with a narrowing of the esophagus. And it causes inability for food to pass, and they will often get recurrent vomiting, and oftentimes that's associated with weight loss. And then if they're having difficulty swallowing or pain with swallowing, again, that would be something that needs further be addressed at in the healthcare provider's office. So again, this is something that we think is more common in people with Down syndrome. It can have some very obvious symptoms, but it can also have some subtle symptoms. And things like change in sleep. And so, thinking about this and keeping this in mind is something that can be helpful. And then looking at, there's lots of things one can do at home to improve this situation that don't necessarily need medications or a healthcare provider, at least initially. Next, we're going to talk about hypothyroidism, underactive thyroid. This is, again, another problem that's significantly more common in people with Down syndrome. So a young woman, we saw a patient of ours, a young woman with hypothyroidism, underactive thyroid, and she was having swings in her moods. So she would go from feeling depressed or unhappy to anxious and agitated and kind of back and forth over several months. So when we saw her, she was feeling low and feeling unhappy. And her thyroid, she drew blood work. She was on a thyroid medication already, but we drew thyroid blood work, and it was indicated that she was either not on enough medication or her thyroid was underactive. And so we had discovered that about 4 months prior, she started sleeping in, and previously she had been taking her thyroid medication as recommended first thing in the morning, and then waiting half an hour to an hour before eating or drinking or taking any other medications. But now that she was sleeping in, she had to take her thyroid medication with everything else, including her breakfast, because she needed to get out the door. We reviewed the recommendations for taking thyroid medication. Again, 30 to 60 minutes before, first thing in the morning, 30 to 60 minutes before other food or any food or other medications or vitamins. And her thyroid blood test and her mood normalized. So what are the symptoms of hypothyroidism? So weakness, dry skin, increased tiredness, increased sensitivity to cold temperatures, weight gain, coarse hair, change in cognitive function, change in thinking or memory, change in periods in women, and then a mood change, as was evident in the young woman we just talked about. So what are some considerations people with Down syndrome? So certainly it's a condition that's more common in people with Down syndrome. About 40% of our patients, and the literature would suggest, depending on which article you read, 20 to 40% of people with Down syndrome have hypothyroidism. Many of the symptoms are already present in people with Down syndrome. So dry skin, we've talked about, is common. Weight gain is already, unfortunately, a common thing in people with Down syndrome. And so there's a number of things that make it difficult to diagnose purely based on symptoms alone. And furthermore, people may not report the symptoms. And then and then as was noted in our patient, even though we already knew she had hypothyroidism, her thyroid function was swinging because she was absorbing it differently because she was taking it with food now, and she had a change in behavior as can commonly be seen. So what are the at-home treatments? If one is already diagnosed with hypothyroidism and is taking thyroid medication, you want to take the thyroid medication consistently and correctly. Again, taking the medicine first thing in the morning, and then waiting at least 30 minutes before eating or taking any other supplements. There's a number of minerals and vitamins that can reduce the absorption of thyroid medication. And so so waiting that 30 minutes before doing that. Some people waiting 60 minutes, but many people get away with 30 is recommended. Again, we have a handout there to help people remember to take the medication correctly. There are some data that suggest zinc supplement may help with the thyroid, but again, you would not want to take it at the same time as the thyroid medication if you're already on thyroid medication, because that could potentially reduce the absorption of the thyroid medication. So taking it with food or vitamins or supplements or the minerals can actually reduce the intake. I'm sorry, not the intake. Can it reduce the absorption of the thyroid medication and cause fluctuations in the thyroid level, which can ultimately contribute to the person becoming, at one point more underactive, and then at one point more overactive, and so it can really cause some swings in the levels when taking it with food. So as far as when to consult a healthcare provider, for those that don't have thyroid hypothyroidism or thyroid problems and with Down syndrome, the screening is recommended every 1 to 2 years by the global Down syndrome guidelines. And then certainly if there's any symptoms suggestive of hypothyroidism, whether the person is taking the thyroid medication or not. So if there's a change like that, then certainly you want to think about checking the levels, the blood tests. If they're on the medication and they're doing well, and then there's a recurrence of symptoms, sort of like this individual I presented, that suddenly there was this change that could be a sign of hypothyroidism. And so that would certainly be something. Is our dose still correct? Is her level correct? And does there need to be some adjustment? And again, sometimes with that absorption going up and down, sometimes people will get, because they're on the medication, now they're sort of in a sense on too much, because we've increased the dose, and now they're not taking it with food anymore, and now they're absorbing it more than they were before. And now the thyroid becomes overactive or hyperthyroid, and that can cause anxiety, agitation, diarrhea, tremor, fast heartbeat, and other symptoms. So again, really important to take this medication the same each day with trying to, again, take it on an empty stomach. So again, hypothyroidism, underactive thyroid is quite common in people with Down syndrome, and very important to take the medication as directed there with on an empty stomach, or it can cause some significant fluctuations in the levels. Another problem that is more common is pneumonia, and so there's lots of reasons for this, anatomic and physiologic and immunity. So what are the signs? Well, let's first off, I'll give you an example. A man in his early 20s had recurrent episodes of pneumonia. And it was reported that often when eating, he would cough and choke. And he was noted to eat rapidly and not chew well, which we had kind of addressed earlier. We ordered a swallow study, and it demonstrated he was capable of swallowing. His anatomy and physiology was intact, and his body was capable of swallowing appropriately. But he tended to eat rapidly and not swallow well, as we talked about before. So he watched our video eating at a healthy pace that I mentioned before, and worked on recommendations to slow down his eating, and his choking and recurrent pneumonia improved. So again, that sounds pretty simplistic, but I would say that's not an uncommon scenario. And so aspirating can be very, very challenging, particularly if people are eating too fast and not chewing well. So certainly signs of pneumonia are cough and fever and shortness of breath and weakness and chest pain. Again, it's more common in people with Down syndrome, and that may be related to immunity, reflux disease. We talked about sleep apnea and swallowing issues can all be related to pneumonia. We talked about some cough suppressants for mild symptoms. And again, prevention, slowing down when eating, good hand washing. We have a video on good hand washing on our website. Sometimes vitamin and mineral supplements may be helpful. A multiple vitamin, a vitamin C or zinc, both have some limited data in people with Down syndrome that they may help improve immune function. Poor dental hygiene or poor dental status can be a risk factor for pneumonia. So good dental hygiene and care is very important. If gastroesophageal reflux disease is, it's important to treat that. And then certainly sleep apnea, to treating the sleep apnea. Certainly consult a healthcare provider if there's persistent mild symptoms. Certainly if there's increasing symptoms, including a high fever. Certainly go to the emergency room if there's any difficulty breathing. And then as far as prevention, in addition, going to the doctor's office and getting appropriate immunizations, it would all be recommended things to do with the healthcare provider. Blepharitis. So a high school student was recurrently getting sent home for pink eye. We examined him and found him to have blepharitis, and he followed recommendations for home treatment, and the frequency of his recurrent pink eye markedly reduced. So what is blepharitis? So blepharitis is inflammation or infection of the eyelids and can cause redness of the eyelids, and it's often associated with sticky secretions on the eyelids or the eyelashes. And it's sometimes associated with conjunctivitis or pink eye or redness of the white part of the eye. It seems to be more common in people with Down syndrome, and that may be related to bacterial infections, acne rosacea, which is a skin condition that seems to be more common in people with Down syndrome. Seborrhea, dandruff it's commonly seborrhea of the scalp, but you can have it in the eyebrows and the eyelashes, and that can contribute. And there probably is a component of this that is autoimmune, meaning that the immune system reacts in such a way to different body parts to affect them negatively. There's conditions like rheumatoid arthritis or type 1 diabetes, which are all autoimmune, celiac. And blepharitis may have an autoimmune component in some individuals as well. So what are the at-home treatments? Certainly trying to keep your hands away from your eyes. That can be challenging because this often itches. Warm compresses can be helpful just to soften the secretions and to make it easier to scrub them. And using half water, half baby shampoo is often an effective way to lightly scrub. And this may take a couple times a day, but morning and night to gently scrub the eyelids and eyelashes. And there's also some over-the-counter eye scrubs that you can buy at the pharmacy. Changing the pillowcase regularly can be helpful. Treating some of these associated conditions I mentioned. And then by ongoing preventative measures, I mean that for a lot of folks, this is, you're not going to just, do the eye scrubs for a week and solve all the problems in life. It's something that for a lot of our patients, you just have to keep doing sort of indefinitely. Certainly consult a healthcare provider if there's persistent symptoms or irritation, if you have conjunctivitis, particularly recurrently. If there's increased redness or swelling, certainly important to consult a healthcare provider. And then if there's pain, certainly would be another reason to consult a healthcare provider. All right, so that is the last of the topics. I just want to real quickly share you some resources. I am on the board of the Down Syndrome Medical Interest Group, and it's for healthcare providers. And so if your healthcare provider would like to learn more about taking care of people with Down syndrome, encourage them to take a look at this. We have both certainly membership, which is from a medical organization, is very inexpensive. There's a speaker series, again, aimed at primarily at physicians that have less experience taking care of people with Down syndrome. And then we have what's called Project Echo, which is where a physician could present anonymously, not the physician anonymously, but the patient anonymously present the patient's case to the group, and the group of experts can assist with the plan. Again, that's for professionals, not for families. So share that. This would be sharing it with your provider. We have a whole list of resources of which we've talked about here. Many of these topics we've talked about, and some of them we did not talk about, but they're all, you'll get these slides, lots of information on these health conditions. I did want to comment, we had lots of questions submitted about health conditions and promoting healthy behavior and hygiene and management of behavior in Alzheimer's disease. These references are also available in the list that you'll get. And so lots of questions about Down syndrome regression disorder and Alzheimer's, a variety of other health conditions. So really more than we could tackle today, but I encourage you to look at some of those resources. Again, we have lots of previous presentations. One of the resources is Dr. Jillian Rourke, who presented a podcast with Dr. Velody out of Down Syndrome Center of Western Pennsylvania. She has a two-part series on skin conditions. I encourage you to take a look at that. There's lots of questions on skin conditions, and those are answered in that podcast. And then our mental wellness book is now free, available online. They're on the resources page there. I encourage you to take a look at that. And we are in effect working on our physical health book that was published in 2010. We're in effect updating and rewriting that, but rather than publishing as a book, we're putting those online at topic by topic. And so you'll see lots more new topics there each time, or each day, or frequently, I should say. All right, so I'm going to stop, and Laura, be able to read some of those questions.
Yes, thank you so much, Dr. Chicoine. I shared a link to the slides in the chat, so you should be able to access that link. I will also be sending it out with a link to the recording, and it has all the resources that Dr. Chicoine just showed. They're organized in a little bit of a different way, but they are all still there. And as Dr. Chicoine mentioned, we have a search function on our resource library, so if you don't find it, you can always search there. All right, and thank you all for your questions. I'm going to go ahead and dive right in. Our first question is, how often should earwax be removed?
Yeah, I would, as often as it takes. I know that that's a vague answer. That varies from person to person. Some individuals we'll see in the office every 6 months and remove the wax here in our office. Some individuals go to an ENT every 3 months to have it removed, depending on what their need are. And then for some people, if it's not a frequent problem, if you just notice that they're having symptoms, you could do the treatments that we talked about, like with Debrox. But for a lot of folks, we just recommend using the baby oil, for example, a couple times a week on a regular basis if they've had recurrent earwax impactions. So really truly depends on the individual and how much of a problem it is for them.
Thank you.
I should add that wax is a natural thing and is good in and of itself. So you don't have to remove it just to remove it. We remove it when it's plugging up the ears and causing problems.
Great. My apologies for my pronunciation. Is ketoconazole an over-the-counter medication? I thought it was prescription only.
It is both. There are versions that are over the counter as well. Ketoconazole is available both as prescription. I think it's a higher strength, if I'm not mistaken, prescription, and a lower strength available over the counter.
Great. Thank you. Will probiotics help prevent both constipation and diarrhea?
Yeah, that's a great question. Again, not to be vague, but I think it depends on the individual. Some people, some individuals we have seen really benefit from probiotic, both from looser stools and from constipation. So the short answer to your question is yes. The longer answer to your question is, for some people that are doing just fine, we start a probiotic and then they develop more diarrhea problems. Can't remember anyone that we started on a probiotic that developed constipation, but and so you really got to kind of judge it by the individual and see how they do. So it isn't necessarily an end all be all for all people. So some people do better if they take it every other day, a couple times a week. Some individuals are constipated, and if they don't take it every day, then they're going to have problems. And so I don't think I mentioned probiotic actually when I think about it. Now that I think about it with constipation, but that is another thing that is very beneficial to many people.
Thank you. This is regarding dry skin. What about oatmeal lotions or baths? Do they work, or are they just soothing?
I think they're primarily soothing, and I think, and I don't remember what I listened to the podcast about a year ago, and I can't remember what she said about oatmeal baths. I think they're primarily soothing, but I encourage you to take a listen to that podcast I mentioned, because I'm pretty sure she mentions it in there, but I can't remember what she said.
Thank you. Is toenail fungus curable?
It's challenging in some individuals. We've actually had some individuals just with the Vicks Vapor Rub every night actually eliminate the toenail fungus. On the other hand, we've had some people take multiple rounds of oral medications and still have trouble with toenail fungus. So it's challenging. Probably the only definitive treatment is to remove the toenails. Then you can't get fungal infection under the toenails because you don't have toenails. But I don't necessarily advocate that. I don't typically advocate for that because then you have a toe without a toenail, a protective toenail. So it's challenging to get rid of no matter what you do, from over-the-counter things to prescriptions. It can be very challenging. The failure rate of all whether it be prescription or over-the-counter, is high. And then the recurrence rate, if you get rid of it, is not small either. So I would say it's very challenging, but not impossible.
Thank you. We had some questions about dry scalp and dandruff. Head and Shoulders hasn't been helpful. Do you have other suggestions?
Yeah, so we didn't talk about seborrhea or dandruff. Again, is something that we see not uncommonly in people with Down syndrome. And just as you mentioned, we recommend starting with an anti-dandruff shampoo such as Head and Shoulders or Selsun Blue. And for many people, they really do need to shampoo daily. And so that's a good starting place. If that's not working, as you mentioned, sometimes putting some oil, a baby oil or something, and just kind of combing it through the hair and then shampooing. Sometimes that softens it and allows it to, makes it easier to get rid of. Someone asked about ketoconazole. There is a ketoconazole shampoo as well as a cream. The ketoconazole shampoo or Nizoral shampoo is something that is recommended 2 or 3 times a week for people with dandruff or seborrhea on the scalp that doesn't respond to the Head and Shoulders or the other anti-dandruff shampoos. Sometimes using a over-the-counter steroid lotion can help decrease the inflammation that can be associated with that, and sometimes helpful. And then if all that's not helping, I do recommend seeing a healthcare provider who can assess it, because psoriasis is also more common in people with Down syndrome, and sometimes that's the cause of the scalp condition. So that might need something additional other than just the over-the-counter treatments.
Wonderful, thank you. Regarding the zinc supplementation, do you still recommend it for hypothyroidism even if serum zinc levels are normal?
I'll just assume that the person is not on thyroid medication. So I would say no, I don't think that's typically necessary. If they're on the medication and they're normal as well, probably not necessary either.
Okay, great, thank you. We are at time, so this will be our last question. But as Dr. Chicoine mentioned before, please check out the resources in our library. There's so much more information in there than we could share in one webinar. And this last question is about gout. Can you address gout and recurrent gout episodes?
Yeah, gout is a condition in which uric acid, which is in the blood, if it's a high level, some of it will deposit in the joints. Classic joint is the is the joint between the big toe and the foot, and can then cause inflammation, and crystals form in the joint, and it causes inflammation. Can be very uncomfortable. Can certainly impact walking and just a sense of wellness that the person has. And so that that's what gout is. And so there are certain diets that do seem to help reduce uric acid. I was talking to your rheumatologist a while back, and I asked her, as I look at gout diets, they seem to be so different. In some, different organizations recommend something, different than the others. And her take on it was that certain individuals respond better to certain parts of the diet than others. So it's hard to really know, what any one individual is going to respond to. But there are some general rules of thumb. Reduce sugar, reduce processed carbohydrates seem to be helpful. Reduce alcohol, that's not typically a big problem in our patients. And so, those are some of the simpler things, but then there's a wide variety. Red meat would be the other one, would be a wide variety of other things you can do. So those would be the home things. Again, if it's a recurrent problem, it's uncomfortable. It may be worth looking at. There are medications that one can take to prevent gout from occurring, happening recurrently. With a gout episode, starting with something like ibuprofen or Advil can be helpful, but oftentimes something more is needed, whether that be colchicine, which is another anti-inflammatory. It's available by prescription, or prednisone, which is a steroid, can be helpful. And there's some other things to be done as well. But again, gout can be very uncomfortable, and so certainly looking at those things. And we do have information. I'm pretty sure we have information on gout on the webpage. I encourage you to take a look at that.
Yes, we do. Thank you. And thank you so much for joining us. I'm sorry that we weren't able to get to all of the questions, but we really appreciate you attending and submitting them. And we hope that you have a wonderful rest of your day.
And we will continue to look at those questions and continue to build more resources. So if we don't have it up online. So thank you.
Thank you.